We are LAM subgroup 2, and today we're going to talk about DMARD delivery options for rheumatoid arthritis.
Rheumatoid arthritis, known as a chronic inflammatory and autoimmune disorder, affects 0.5 to 1% of adults, leading to joint damage and systemic disorder. Disease-modifying anti-rheumatic drugs are used to inhibit the joint damage. Understanding the limitations of current oral and parenteral DMARD delivery methods, which include poor patient compliance, oral drugs metabolized in the liver, and injection site damage. Our objective is to design new drug delivery system which can effectively deliver a combination of DMARD therapies and improve patient compliance.
This slide displays our design process, which ultimately led to our two final design options of transdermal microneedle patches and nasal spray. This is due to their exceptional performance throughout the design selection process, including a WDM and sensitivity analysis.
We also conducted a thorough stakeholder assessment to better understand the perspectives and needs of different stakeholder groups. The key groups that we identified as stakeholders for this project are rheumatoid arthritis patients, the physicians who treat RA patients and prescribe medication, the Canadian healthcare system, which funds patient care, and the drug manufacturing companies, which make DMARD drugs.
The two most promising design options that we selected were nasal administration and transdermal microneedle patches. Nasal drug administration can come in many forms, but the most widely used is a multi-dose spray applicator. These have started to see widespread use with many drugs, and more recently, vaccinations, naloxone, and some pain medications. This is due to its ease of delivery and self-administration, non-invasiveness, and a low risk for injury or infection. However, nasal administration has a large variability in drug absorption rates, and the effects of delivering DMARD medications through this route are largely unstudied in humans.
Transdermal microneedle patches contain hundreds of needles from 25 to 2,000 microns in length, which interact directly with the epidermis or dermis of the skin, and therefore avoid stimulating the nerves and so are painless. Dissolving microneedles use biodegradable polymers, such as PVP, so they dissolve right into the skin. These microneedle patches cost 1/3 of the cost of a regular subcutaneous injection and pose no risk of sharp injury or bloodborne pathogen spread after removal. Taking our two most favorable design options, we identified the largest risk associated with each and designed an experiment to address it. For nasal, the purposed experiment was nasal clearance and vascular reactions and how they pertain to the safety of nasal administration. For transdermal microneedle patches, we designed an experiment to address dosage accuracy using different shapes and materials. We also conducted drug release profiles for each design option, giving us a better understanding of each respective method, the results of which can be seen in the diagrams below.
Based on the research and analysis conducted in this project, our team recommends dissolving microneedle transdermal patches as a new delivery system for DMARDs in treating RA. Additionally, we recommend further research into nasal spray delivery, as this technology would have greater potential for clinical use if the risks were better understood. We hope that the findings of this project can be used to influence further research and ultimately help in developing a better treatment option for RA patients globally. Thank you.